So the Food and Drug Administration first approved the injectable medication for treating diabetes in 2017. The agency approved a drug with a higher dose of the active ingredient in Ozempic, called semaglutide, to treat obesity in 2021 under the brand name Wegovy. Since then, talk of the drug has popped up across the internet. Elon Musk, when asked about how he looked fit, ripped and healthy, tweeted that he was taking Wegovy. Andy Cohen posted about Ozempic's growing popularity. So Ozempic, as stated on its website, works in a 3 ways to lower blood sugar, because that was the intended goal for the drug. It helps your pancreas produce more insulin when your blood sugar is high. It helps prevent your liver from making and releasing too much sugar, and it slows down food leaving your stomach, so you feel less craving for food. In September, Variety reported that actors and producers are quietly singing the drug's praises on Signal, an encrypted messaging app. On TikTok, the hashtag Ozempic has been viewed over 273 million times, with people alternatively expressing shock over their supposed medication-induced weight loss and swapping stories about side effects. Thousands of people in Britain will soon be able to access Wegovy as well. And Ozempic and Wegovy are not the only medications gaining popularity for their weight loss effects. Demand is mounting for Mounjaro, a diabetic medications from Eli Lilly company that manufactures it, says it will provide a dramatic weight loss results for people with obesity and diabetes in trials using tirzepatide, the active ingredients in Mounjaro. Other drugs that use a similar mechanisms to Wegovy and Ozempic are also being developed. Ozempic and Wegovy, they are manufactured by Danish drug maker Novo Nordisk, and CNBC reported that on Friday, Novo Nordisk briefly overtook French luxury goods giant LVMH to become Europe's most valuable company. And as I said before, Novo Nordisk produces blockbuster weight loss drugs, Ozempic and Wegovy, which have generated massive hype over the past year. So let's talk about how does Ozempic work. Ozempic and Wegovy are both designed to be injected once a week in the stomach, thigh or arm. The way Ozempic works is the active ingredient semaglutide lowers blood sugar levels and regulates insulin, which is crucial for people with type 2 diabetes. Also imitates a hormone called glucagon-like peptide 1 that we naturally produce in our intestines, limiting appetite by signaling to our bodies that we feel full and prompting our stomachs to empty more slowly. As a result, people with obesity and accompanying health concerns have lost weight while taking it. People feel fuller faster. For patients taking the medication, foods that used to be really exciting to them are no longer exciting. The medication has not been significantly studied in people without diabetes or excess weight. Next, let's discuss what are the biggest side effects of Ozempic. The most common Ozempic side effects are nausea, vomiting, diarrhea, abdominal pain, and constipation. Serious Ozempic side effects include allergic reactions, changes in vision, and pancreatitis. Ozempic has an FDA box warning for the risk of thyroid C-cell tumors. Another consideration to keep in mind is Ozempic may age your face. The website medicalnewstoday.com reported that Ozempic should be used with doctor's guidance. Ozempic can cause rapid weight loss, which can be particularly visible in the face. A sudden loss of fat cells can reduce the appearance of smoothness and fullness in the face. So that's something to be keep in mind. So one of the questions that people usually ask is, can you lose belly fat on Ozempic? So answer is yes. There is evidence suggesting that both Ozempic and Wegovy can help reduce belly fat. A study funded by Novo Nordisk involving overweight or obese individuals without diabetes found that semaglutide, the active ingredient in Ozempic, reduces fat and total fat mass. So another question people usually ask is, does Ozempic helps weight lose by making you feel full? So the answer is the active ingredients in Ozempic, which works by inducing satiety, which means this feeling of being satisfied or full suppresses appetite. This is why it works for weight loss. Semaglutide also helps the pancreas produce insulin, which is how it helps manage type 2 diabetes. So how long you can stay on Ozempic? There is actually no limit to how long you can take Ozempic, as long as you tolerate it well and your healthcare provider thinks it is the appropriate medication for you. That brings up this question: do you gain weight back after stopping Ozempic? So you start feeling those usual hunger pangs again, and consequently you may start eating more to satisfy that hunger. An increase in your consumption can lead to the regaining of weight that was lost. A 2022 study found that most individuals gain weight back a year after stopping the medication. Next is cost. How much does Ozempic cost without insurance? The manufacturer lists the price of Ozempic pens as $935.70 US dollars. This price applies to pens of all strengths from 0.25 to 2 milligrams. But your exact treatment cost depends on your prescribed dose. Many people start with a dose of 0.25 milligram once weekly for 4 weeks, then increase to 0.5 milligram weekly. And depending on how this manages your blood sugar, your doctor may increase your dose to a maximum of 2 milligram weekly. So who is supposed to take Ozempic and Wegovy then? After the FDA approved Ozempic for people with type 2 diabetes, the agency approved Wegovy for adults with obesity or excess weight with at least one weight-related condition, which the agency considered to be issues like high blood pressure, type 2 diabetes, or high cholesterol. The FDA defines obesity and overweight using the body mass index,